Start us out. All right, well, good morning, everyone. Welcome to the final webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. And I maybe shouldn't say final because we are in talking about possibly extending this series into the next year. But today we're going to be learning about the art of storytelling. My name is Kim Norden, and I'm a program coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. We designed these webinars to be interactive, so we'll be asking you to complete some polls and participate in some chat box discussions. You can unmute your phone line and use your voice to speak at any time. If you haven't already done so, please add your name, title, and organization to the chat box, which you will find on the bottom of your Zoom screen. The slides for today's webinar can be found on the event page, which I did link into the chat box. If you have any questions or comments today, feel free to use the chat box at any time. We'll save some time at the end of this webinar for our speaker to answer any questions that come in through the chat box. To avoid background noise and feedback, please remain muted when you're not speaking. Now, let me introduce you to our speaker, Brian Lanny, Vice President of Creative Services at Legato. Brian comes to Legato with decades of healthcare communications expertise, most recently as the Vice President of Brand Strategy for Previa Health and HSHS Eastern Wisconsin Division. Brian has been an active participant in the AMGA Leadership Council. Over the years, Brian's combined his creative skills with business leadership as a creative director and agency owner. He holds a BFA degree from the University of Wisconsin-Eau Claire. Thank you for participating today, everyone. Go ahead, Brian.
Thank you, Kim. Appreciate it. And thank you again for, I'm speaking in part for Legato. Obviously, this is the final, if you want to say chapter, we're talking stories today. So this is the final chapter of the outreach and education series that we've offered. I'm hoping that for those of you that have joined us for this 8-week series, you've walked away with some things that you can take forth in future communications. So anyways, with that said, again, just acknowledging that the Delta program, that there's support, as far as the support of this program has, of the educational webinar series is through this, and it is directed towards the Delta program through the Resource Center. This is me, obviously, you can see me for real here, but that's me right there, so. Okay. So storytelling. Today, what we're going to do when it comes down to talking about storytelling, here's the agenda. What we're going to follow is why we want to talk a little bit about why are they so effective in our lives. We also want to really break down what is a good story? What's it made up of? And also, why stories, our human brains, the experience that our human brain, when it processes a story, how is that different than listening to the facts when we're told directly in a different way? We're going to talk about the importance within storytelling within healthcare. And then I'm going to kind of break it down and talk about how can you develop a storytelling strategy. One thing that I'll go to next is really an application of it. One of our clients, that it's a case study about storytelling and what they did and in order to push these stories, multiple stories out to the community and internally throughout their organization. We're also going to talk about, obviously, COVID and how storytelling is now a huge part of that, especially in these past few months. Seeing we're at the end, we're going to give you a survey. So post-webinar survey, we're going to provide you the link to providing us with feedback. As Kim had mentioned, that what we're looking at, we're in discussions right now about continuing the webinar series into next year, possibly having it about the same time next year. So hopefully we can do that, and we want to get your insights into it, what you thought of this eight-part series, and if there's some things that you would like to hear about in future series. So with that, let's go to what we always go to, is the pre-poll question. So the question that we have is, how confident are you in your understanding? Oops, let me get this on my screen because I just got covered up here. How confident are you in understanding the importance of storytelling to create a relatable content while educating and building confidence and humanizing your organization's image. So,
And we'll just give folks a few seconds here to answer the poll. So far, we've got about 45% of people who have voted.
Okay.
There's quite a bit of high confidence today, high and medium
That's
confidence
good.
today.
That is
Yep.
good. And I think that, within this, I guess what I want to do is, I was kind of expecting that today, because I think in the roles of each of you, stories really are a piece that are a key, if you want to say testimonials, are a piece that I think with any organization, they see that opportunity in those tools. And so what I'm looking at today is I want to hopefully show you some other ways to disseminate that information when it comes to a story. But, let's see where we go. But right now, as you said, we're kind of right in the middle. We've got majority in the medium, but there is right above that. So anyways, let's go. Okay. So now it's my time to tell a story. The story is about storytelling. So I guess to start out with, when you think of storytelling, what do you think of? I mean, bottom line, we all have those feelings about storytelling, and it really came as a child. Those childhood stories that we shared with our parents or with family or whomever it might be. That's a huge memory. And now, even for myself right now, I got grandkids. My wife's a librarian, so I better be in the storytelling, because we have a lot of books at our house. But for our grandkids, that's a huge piece to be able to tell stories. And whether it's written stories or stories about us, that's an important part of our lives. Noted on there, campfires, fairy tales, elements like that. Those are things that that we have shared since we were young. Stories are all around us at all times. And I think that's what you see, that whether it's with your family or friends, but it's also when you come into the office or into your hospital or your clinics, you can be with your coworkers, your neighbors, the neighborhood connection that you have. That's I know for myself, we've got a great neighborhood, and be able to have that connection of talking, telling stories is great. And then ultimately, what are we here to talk about? It's your patients. This being able to share stories with your patients. So they are part of our daily life. That's the thing you see. Now, at times, they're an escape. I think when you look at TV and movies and books, podcasts, blogs, whatever it might be, that's that personal downtime. Many times you're sharing that with others, but often, right now, I think you look at where we are today, we're looking at it as escape, to be able to listen to a story being told to us with that and following that along. While also effective is because, as said before, it's been with us since the beginning. It's passed on from generations. Being able to pass that story to your children, your grandchildren. It can be about your family. It can be really what really shaped your family, and how that much like the visual in the picture, grandma passing this on to the grandson, that it's passed forth, and these stories are carried on about your families and things like that. So we like stories for different reasons. We all do with it, whether it's a real life story or it's a documentary, whether it's something that's out to entertain us, and as I said, almost distract us at times, or it's the type of thing that we're learning from it. It's a teaching tool. But it really makes us think. With that, what we're trying to do is to connect right now. It's a challenge right now. Look at us all. Here we are in our little screens, little boxes on the side. And being able to FaceTime and connect, Zoom, whatever it might be, being able to connect with family, friends, and tell stories and be able to share stories is huge. But at the same time, as I talked about all the different mediums that are out there, we're looking at those. We're trying to make that connection right now that we don't have. And it's not just because of a pandemic that storytelling is big. It's just I think it's starting to rise up that we're kind of all seeking some of this out at the moment. So on the front end, we asked that question about, your confidence of it, but I guess I'd like to hear from you in regards to your organization. Really define that. What does that mean? What types of stories are you doing internally and externally?
Yeah, and you can type a response into the chat box, or you can unmute yourself and speak with us.
Mm-hmm. Yeah, please. Oh, you're so shy. Kim, I may ask for your assistance if anything comes in chat-wise.
Yeah, I will let you know. I don't see anything yet. Hopefully
Okay.
people are chatting or typing into the chat box. Geneva,
Yep.
did you want to share?
Well, I'm getting ready to write the report that y'all have asked us to write about the Survey Monkey we took. So since I'm going to be sending it to community joint partners and everything, I kind of thought about writing it as a story, starting out at the beginning of the hospital, when it was built, and just kind of a very fast journey as to where we are today and what we're looking at. And I didn't so anyway, that's kind of what I was thinking about doing for the storytelling that we're doing that's due tomorrow.
Mm-hmm. Yeah, that actually is a very that is a good angle to go with that. We've done community report type of pieces that, a lot of times it's facts and numbers and things like that, but really, how does that relate to the stories of the community? So really bring that to life that way. So that's through that voice.
Yeah, and Linda has shared what we do to support coworkers as they're going through difficult experiences, patient experience, and different services that they offer. Lisa shares that we have nursing home also here. We try to share out via social media the events and activities that the residents here are able to do, and share out the experiences that are happening in their nursing home.
That's perfect. Yes. Yeah. Bring it, again, bring it beyond the facts of it, bring it, and with the imagery of it or the voices of it. So, and you'll see some of this as we go further into it. Okay. So a good story. What, when you look at it, what's it made up of? It's 3 parts of a good story. Not surprising, a beginning, a middle, of an end, but you don't want to start a story and it just keeps rambling and rambling. You do want to have this kind of build up and then have an ending point to it. With that, it is a thing that, though, when you have certain stories, it's never ending. And I think you can bring that even to, if you want to say, if you're looking at a cliffhanger of a show that you like to watch, that the end of the season comes and they're going to pull you along, even though there might have been some sort of an ending for the season, they're going to pull you through. And they're going to start the process over again. Or if it's a book, like Harry Potter series, you wouldn't have a series of books if it didn't do that same process. They took you from beginning to end within one book, but then they pulled you along and they extended the story within that. So, much like that, when we look at a story having 3 parts, there are actually 3 components of effective communications through storytelling. We look at it as it has to be authentic, it has to be relatable, and it has to be memorable. Now, when you look at that, it really, when we put all those together and we're telling a story, the relatable piece all comes together. The empathy, the feeling, that's what we're trying to come across. So it's no longer that it's, as I said, the details of it. By wrapping it all together through those 3 pieces, it becomes much more memorable within there. That's that final piece. So when you start with it's authentic to begin with, I can relate to the authenticity of it, of what you're telling me, to the story of it. I'm actually in your shoes with this. And as you're going through it, It's being captured in my mind. And I'm almost personally invested in this story because that memory, it starts to lodge in my brain. So now I'm going to become a scientist here, or a doctor, or whatever you want to say. Stories are hardwired when it comes to the human brain. They are hardwired for stories, the brain is. The human brain understands experiences better when they're narrated in a form of a story. You know, throughout the day, you're hit with details of things. You can be in meetings and you're taking notes and you have a lot of stuff that's being shared with you. You know, if I asked you, oh, let's see, today's Thursday, what you had for dinner last Thursday, if there wasn't a story built around it, you might not remember it. But if there's a story built around it, that memory, the details of it are much more ingrained in your mind of it. So by creating stories and incorporating, if you want to say some of those details into it and having it from a voice, it does, the way your brain processes it, it'll hold on to it much longer. So that's where it comes back to it. Healthcare storytelling is more important than ever because it really humanizes your image. And now we go back 2 webinars ago when we talked about your image and the consistency of your image, what you aspire to be. Storytelling can be that springboard for you to be able to do that, to show as an example, this is what we stand for and this is what we aspire and this is our personality. The story is going to build that personality. Now, obviously lately within healthcare, as I said earlier, and we'll touch on it at the end, the COVID piece of things, but that's where you do see that stories have allowed organizations to almost make a plea to their communities about the seriousness of the situation and do it in a way, in a voice, rather than just being wear a mask, wear a mask, wear a mask. It's other details that are there. So these have started to become, especially, you know, what I've seen over the past 30 days, you hate to be grim about it, but they are much more realistic than what in the early stages of it. So, and, you know, again, it's really what's been great though, this last week has been the word hope. The stories that I'm seeing and hearing, hope is now all of a sudden entering the picture of the story. So in a way, are we at the beginning? I hope not. Are we in the middle of the story? I hope we're a little bit further beyond the middle of the story. I hope we're getting towards the end of the story, but there's still more chapters to go on it. So the what's and the whys. When you look at that, we want to talk about humanizing your brand. And within a story, we all have the what's. It's really not, I don't want to say there isn't a lot of difference. It's the services that we offer, it's the physicians on staff, it's the medical conditions, the locations, the terminology, things like that. Those are the facts that we're sharing, but those are the details that, again, kind of get lost in translation at times, or it feels like, yeah, but how are you different than another organization? The whys are those PowerPoints. Those are those things that motivate. And with it, it starts to show the empathy and you start to build the relationships and the trust. It brings stories to life and a connection and a loyalty to your organization. And again, it goes back to, it really aligns with the image you're trying to project. With the whys, if put together properly in the way that it flows, it's going to motivate. And I hate to say a bad example of this, I'm going to leave healthcare, but infomercials follow this to a T. Infomercials are the type of thing that they're going to, if they just got on the air and said, this is what it does, this is what it does, this is what it does, you wouldn't buy it. But if they're going to make a promise of how it's going to change your life, and it's going to show, and you're going to hear from voices of people saying, this is what happened. I was never a cook before, and now I do this, and now I'm a master chef within this. I have to have that. I have to buy that. So it is pulling them along the journey of this. in that way. So you do have to remember your patients are consumers, same thing. So we want to get them to follow that journey again. So, where we're going to start with this. So the base point of it is really looking at who's your main character of your story. We can easily say, we don't want it to be, if I want to say a doctor that's just saying what I do. I mean, I think there's a time and a place for that type of, even within social media, introducing a provider within social media and doing it in a somewhat of a factual way is good, but it's nice to be able to go beyond that to talk about, and I think probably for many of you, you do this, that you're introducing them through their bio, what they stand for, getting it from the voice of the individual, and really why they do what they do. That's a story. But if it was just getting on there and saying, this is what I do, and this is my credentials, that's more the facts. Again, that's the what's, not the whys. You're wanting it to be a person that's saying, how what's been done for them. And, from an employee standpoint, sharing their own personal whys so that the person listening to the story, again, can relate to it and understand and be in your shoes with it. I think what it comes down to, you don't want to be talked to. You want to feel the connection on it, that emotional connection to what's there. So with that, your greatest assets, your stories can be your greatest assets. And when you look at the mix of people that are on the screen right now that I have up there, that's your characters. It's your patients, it is your caregivers and your physicians. It's the entire workforce as a whole. And when I say the entire workforce, I'm saying every individual that works at your organization is a voice that can tell a story. They all hear it. They all see it. It can be the person that is at the reception desk when people enter. It can be housekeeping, what they see and feel. Now, obviously, we got to be careful with HIPAA. We get that, but it is the type of thing that we all have a story, and within that mix, there's your characters as we look at it. So the process, when we go through, obviously, number one, as we said, defining your character. But in order to define your character, this is what we need to look at. You need to know the audience that you're trying to speak to. Who's going to benefit from this story? Is it a story that's inward facing? Is it going outside? It goes back to some of the things of when we were talking about targeting certain messaging. What's the demographic? What's the age we're going after? So really clearly defining that. And I think once you have the foundation of that, then we can move on to the next thing of defining the goal of the message. And this kind of ties into number 4 too, the call to action. So really the goal, what sort of action do we want the individual who's listening to the story to take with that? It doesn't mean that, the goal of a message can be as basic. It doesn't mean you're going to take action, but it could be that it's just you're building trust and confidence. But with others, a goal of a story could be that an individual, you're trying to get people to relate to the story, that I have that same knee pain. I understand what that gentleman is talking about. I live that. That's me. And now I want this sort of action. So that's the type of connection you're wanting. So with that, we need to decide, what kind of story are we telling? When I say, is it about a service? Is it about a certain service itself? Is it about your organization? At the beginning, when we were talking about that, I said from the perspective of the community needs, hearing from the community about your organization. It's not me telling you about your organization. It's the community telling the rest of the community about the organization. It again is a tapping into emotion with this, because with the right story. I'm not saying every story has to have, it doesn't have to be a tearjerker. Oh my gosh, no. But it is looking at the emotion that triggers that action. It's a demonstration of your empathy and your caring that's there. But it can be just as basic as education. Wrapping it in the way of a story that, again, it's not, I'm not going to class 101. It's telling a story and learning from it. And then once we have all that together and being able to package that, it's determining really the right medium within this to be able to push that out. That went back to the demographics, some of that, but it's also where's your audience? Where are they at? And who's going to disseminate this? It can be done, in digital form. Obviously, digital stories are huge right now. Video stories, the action of the click-through a video story is much greater than just having you type up a story itself, because it's lacking that emotion of the voice itself or the visual of the individual. But when you look at websites and blogs and social media outlets and digital within this, these stories have a place within those, that it could be a housing. The website could be a platform that really is a destination of stories that your organization could house. Traditional advertising like print, broadcast, again, that can bring the voice and the face into it. But we can also, when we look at video can be the type of thing that we're really capturing the spirit, and it can be done without high-end production when we're doing storytelling. It can be as simple as phone video from the individuals being able to tell the true story from their heart of what's happening. It can be incorporated into your presentations. And obviously, PR stories have always been there. And I think that's to be able to have media relations and be able to build those stories and push them out to the community. I think that's probably for all of us, that's probably our number one storytelling mechanism, to be able to do that and be able to have that connection and have, whether you're pushing that story or you're working with the media locally to be able to share that story. Foundations, it's a great opportunity to be able to, again, show not the what, but to show the how, the emotion of why, to be able to continue to have the community support the foundation because they're seeing through the stories what's occurring, and not just we purchased this, but what that purchase meant to an individual. It saved a life. It's somebody that has a story that is either told by themselves or by their caregivers or their children, whoever it might be. But again, it builds that empathy, pulls on the heartstrings, and hopefully potentially supports your foundation. PFAC groups, patient and family advisory councils, it's a great way to be able to share it and have them carry the torch forward of the stories. And the same thing with ambassador programs. I know Mike Milligan shared that earlier, how to create an ambassador program, but it is the type of thing that allows you to push these stories further out into the communities. Okay. So what I want to do is to share with you a story, a case study. And this is for an organization that Legato works with, Ely Bloomington. And Ely Bloomington Community Hospital is located in Minnesota, northern Minnesota, right up on the boundary. I mean, they are the boundary waters, top of the state. So with this, the goal of this, when we first looked at this, was to start to do a brand campaign. And this project actually started January, February. And obviously, not much was happening back then, but there was being recognized that with this, that Ely Bloomington, even though they are, located up there, their board of directors had given them a charge, meaning their communications department. In the strategic planning stage of this, it was recognized, and you can kind of see this campus on screen. The campus itself houses the hospital, but it also houses a clinic that's owned by a different organization, Essentia Health. And then there's also a long-term care facility, which is not under the Ely brand either. So there's a lot of confusion about who are the people of Ely, and really how do the organizations differ. And with Ely, leading into this, probably about just months before we started talking to them about this, they entered into a service excellence program with this. So with that service excellence, as noted, they really wanted to build a positive reputation within the community, but they also wanted to build employee pride with that. So the service excellence program was at the early stages. It's a 3-year program that they're going through, but they've got the foundation in place of what they're going to do. It's really, when I go back to the image, what do you aspire to be? It's not that they're bad, but what do you aspire to be in the community in the future with this? So from that, we looked at the objectives of saying, okay, let's break this down. We know what the board is looking for, but okay, what are our objectives, key objectives to this? Building awareness to help distinguish differences within the campus. That's important. We want to make sure that we include the staff in this because we want to showcase the pride that they have, because they do have pride. We're hearing it through some of the front end, if you want to say, the research that we did and the conversations that we had. Even though they started the service excellence program, it was already ingrained. Individuals that were there, they're just trying to sharpen their pencil, if you want to say. They're trying to be the best they can be. So to go out there, because we had the question, it was like, okay, we're going to go out there and we're going to say this is who we are, but are we living that today? You know, you got to be careful. It's got to be honest with what you're doing when you're telling a story. And it was proven that they were being honest with this. We wanted to make sure that whatever occurred here, it had longevity. It wasn't just a short-term campaign. And you heard me say multiple chapters before, but it is the type of thing that the chapters may relate to the community internally. It could even carry over into recruitment, but it's not going to be a one and done campaign. It's going to be the type of thing that the stories are going to continue in a lot of different ways. And in doing so, demonstrate how we're making a difference along the way. But when I said how everything changed when this started, all of a sudden the stories changed too. And all of a sudden, the individuals that were part of the stories changed too. Not that they were different people. It came down to people wanted to tell their stories. When this first came up and we presented the idea to the organization, they floated it amongst many of the peoples within the departments, the people that I mentioned, the people that are working the front desk and other people. Everybody's like, oh, that's a great idea. But nobody wanted to do it. Well, I don't want to have my picture taken. I don't want to have my voice, I don't know what to say. I honestly don't know what to say. So, with that, in March, when things started to change, all of a sudden the voices changed too. There was a whole different vibe, if you want to say, within Ely, that they didn't know what to do. They didn't know, what do I say? Meaning, what do we say to the community through traditional communications? We want to make sure that we're giving them, really, we're there for them, and that we're not going away, and that we're here. But suddenly, we were able to capitalize on the healthcare heroes that were working at Ely. And that's the people, and we could showcase the pride of those people, the employees, the physicians, the nurses, the volunteers, that support staff, as I mentioned, and do it in a way that they get to be able to talk about the service excellence, but not in the technical way. Do it in the way that they do in everyday language within this, and what it means to them and why they do what they do. It's the whys. With it, what started out as 2 people That's what I said back in early days. We had two. That's all. Two people wanted to do it. That's it. It suddenly became a waiting line. We could not use all the people. We were able to spread them out over different mediums, and we still have more people to go yet. So it definitely became a powerful way to be able to push this out and have the support and people, the internal, if you want to say, meeting the objective of showcasing their pride, but also patting them on the back about it. So the concept behind this that we ended up developing when we say the why was sign language, my reason. You kind of saw that on the front end as we entered this. It really highlights each individual staff member with a handwritten sign that talks about the reason of why they work at EVCH, but why they actually do what they do. Even if it wasn't at Ely, it could have been at another organization, but why do they take the steps forward to do this? And why do they continue to do this, even during the challenges of today? In their own words, the staff members basically, we interviewed them. Our writers just sat down and actually did one-on-one interviews and captured this information. And obviously we had to bring it down to shorter ones, but there were places that we were able to tell the larger story. And each of these individuals, you'd think that some of it would just be a common story time after time, but it wasn't. There was a human side to every story that was there and why they're doing the job they're doing. So as when we look at it, this kind of gives you a feel of what we were doing. We'll start out with, I'm going to show you a series of the pieces that we did. Started out with print advertising. For Morgan, she's the receptionist, as I said, the first person in, the entry point within that. Her statement that she said to us was helping people smile even when they don't feel good. You know, I think that comes down to all of us. We're in our jobs and we're, hey, this is great. This is my job, you know, but they're there, probably could be the worst day of their lives. But I think for Morgan, one of the one things that she had said on her, and I may say it again here, but part of what she likes about it is she really tries to make them smile, as she said in the first headline, but she expands upon that, what she does with each and every person. It does go back to that image that I talked about earlier when I said, you know, the receptionist or the person on the phone maybe, I don't know, is really busy. But for Morgan, she really makes a point to, from a customer experience, to be able to put that out there. And it's important to her. And she's a face to the community. Mask on, mask off. That was a situation too. Do we do it with the mask on or do we do it with the mask off? We determined to do the mask on because it was the common state at this point. Couple other newspaper ads. Chris was in the pharmacy, and actually I'll share Chris's full statement at the tail end here because he basically, Chris does what he does because he's third generation of pharmacists. And with this, and it's really important to him that he's able to bring this back to the community and to his friends and his family, that he's there for them to do this. Tiffany was also an Ely native within this. She's an educator, she's an infection prevention control, and it's not just a hospital. We're so much more, and she really meant it through, as she goes through the story, personal stories of why she's meaning this and why she wanted to be a part of Ely growing up in the community. Now with Victor, this is where we start to get into helping people in a time of uncertainty. I'm going to try to play this, and I'm not sure how it will stream. This is a radio spot with it, and he comes in towards the tail end of it. So it's a 30-second spot.
Individualized care by individuals who care. These are the people of Ely Bloomington Community Hospital and the heart of our healthcare system. And while the reasons for choosing healthcare and EVCH vary, our commitment to provide the best patient experience is our foundation as providers and as an organization. EVCH radiology team leader Victor decided at a young age to pursue a career in healthcare.
I was 6 years old and on vacation with my family when our father became extremely ill. He spent the next 6 months in the hospital on a respirator and was confined to a wheelchair.
Oops, sorry. It clicked out. Anyways, apologize for that. But with Victor, it is that situation that it was a family situation that occurred. His father ended up being okay, but that drove him as a child to say, I want to be a part of healthcare. He didn't know if he was going to be part of Ely Bloomington, but it drove him in the direction of the career that he went within this. Oh, okay. So website, I talked before about the landing page, that being a destination of stories. This is a great opportunity to be able to expand your stories. When I said that our writers actually spoke and really got the foundation of each of these stories, it was a shame just to kind of just take a soundbite or a clip of like 3 sentences instead of being able to tell the entire story. So within the site, there's a destination on this of pages of why they do this. And I mean, it's kind of cool because when we look at it, that after launching this and having the campaign out in the community, within the second month of the campaign starting to run, this page that housed all the stories jumped up to being in the top 10 most visited pages within their site. So that's, you know, amongst services, amongst careers, amongst events, amongst everything that was amongst COVID. It's at the top 10 within there. And on top of it, we're hearing quite a bit in regards to whether it was the radio or the print or this or other elements. These individuals were being followed up on the streets or with people that they knew, just the support they were hearing and the appreciation of them sharing their stories. It did cross over to Facebook. We were able to, again, this connected to the website for the bigger story, but being able to push those out. Again, the likes and the shares on this was huge with it. Ely Bloomington does have a community publication that they send out quarterly within this. And again, this was a great platform to be able to place these stories in. Much like with the media stories, they have this. You know, they have found that their community publication is really very valuable. But again, it really pushed community awareness of these stories at a much higher level. For some that maybe from a media standpoint, because you got to remember, not everybody's going to be connected to the media for these stories, or they're not going to trip on your website. But being able to push this out, have it come in your mailbox, and have it be story time, if you want to say. We always look at our community magazines, is they're not, again, it's not about what, it's about how. It's coming from the voices of the community about our organization, or it's us talking about the community, about people in the community. And it's not all about that. So this was a perfect platform for that. And then finally, when we look at this, the last piece of the puzzle was what I talked about with the career section. In the situation right now with pandemic, during recruitment, you're doing it from afar. The site visits, having feet on the ground with an individual, being able to talk to people, to walk through the organization, to really get an understanding of what they're all about isn't there. It's an online Zoom interview. It's a phone call, whatever it might be. This gave the opportunity that we had this connected through the career site, that as people were looking, and they were looking at CFO levels, and they were looking at physicians and others, a lot of different levels. And this gave them an opportunity to support that using assets that were there, extending this story into a lot of different areas within that. Now I talked about with Chris. I'm gonna have to look at a different screen here. I'm gonna go over here. So excuse me if I'm looking this way. This is what Chris had to say about the whole storytelling piece. He goes, with corporate conglomerates taking over healthcare world, it's easy to forget that a person on the other side of the phone, email, or even the desk is still a human being. It's even easier to forget that a majority of healthcare providers are in the field because they deeply care about helping people. When we storytell, it gives our patients a glimpse into what drives us to work each day. It shows to them that we do care about their lives, their health and experience, and it's not just the bottom line. So, you know, for Chris, it is, you know, we all have a passion of why we do this. And it was kind of cool for him to just, we didn't ask him to say anything like this, but it was like, could we write that down? Because that's really good. So kind of bring this towards the end of this is the next chapter. And obviously Ely Bloomington experienced the next chapter, and they are continuing to experience it. The stories, they're continuing to develop the stories, but the voices are changing, as I said, different people, and the stories are changing a little bit too with this because of what's occurring. What started out as little or no cases within many of our communities is much higher now, and we're challenged with the disbeliefs or the burnout. I've done everything I can do, but the end is in sight. We've got a vaccine. I'm just tired. And it's the empathy for the hospitals. I think we went through a cycle of, if you want to say, empathy was there during the front end, and then it's been kind of this roller coaster. So attention for the COVID cases right now, I think what we're seeing on our end is with our clients, it's so much attention goes to the cases that it's shifting away from the beds that are needed for other things. And these are the stories that we're not looking at physicians getting on talking about the COVID cases, but it is talking about the side effects and the challenges that they're facing. So that's where we're at with some of our clients. So it is the opportunity to be much more authentic with that. Within this, and I'm not going to click through this, this is, if you download the actual presentation, you can get the address for this, but Pender Community Hospital right now is doing a series of these COVID highlights. It's individuals that are working within this, and it's a very, they're telling their stories, their experiences of what they're going through right now, and personal experiences too, just in regards to, I know for this young lady on pictured here, a lot of hers had to do with afraid to going home because she was afraid at the beginning that she was going to be spreading things to her family. So it's creating that separation that occurred and that emotional separation that occurred. So these are the types of stories. To the right, as I said, hope is starting to, this is not something that's run yet, but this is something that's going to start to push to other stories. And it really has to do with that we're all facing this together, and hope is right there on the surface for all of us. Locally here, we did not do this, but I decided to include it. This is, and I encourage you to watch this because it's 4 different providers and their stories, how they all come together from different perspectives within one hospital. I do know individuals that were part of producing this, and what they did is they basically selected the 4. They provided them with the questions individually, and they told them to go to a room by themselves with their iPhones and record this and be honest. This is just, but realize we're going to take your stories and we're going to bring them together as one. And it is a pretty solid story when it comes together. So as I said earlier, it doesn't require a lot of huge production to tell a story, to be able to do it, to have impact within this. So again, don't be afraid to tell the story. Everybody has one with that. It can take on many different angles. Look for that opportunity to catch it. And remember the other piece of it. Keep it personal, keep it authentic and real with that. Focus on the emotions of the individual telling the stories, and with that I can relate to. If I heard that story, can I relate to that? With that, making it warm and memorable, because your brain is going to, that's what they're going to do. They're going to pick up on that memory of that. Regardless of how long or the format, think about that again, where that beginning is and where the end point is of this, that your story, that it all comes together, but also think about where you're going to go next with it, that it doesn't have to be an ending. It can be a continuation. It can define your image from this point forward. With possible, include photography and videos. I think it does elevate the authenticity of the story within that, and then look at that, extending it to future chapters with that. Okay. So we're at the post-poll question. Woohoo. You still there? Everybody still there? Okay, so how confident are you in understanding of the importance of storytelling to create relatable content while educating, building confidence, and humanizing your organization's image?
Well, we've got about 50% of people who have voted so far, Brian. It looks
Okay.
like 77% are at high confidence. We've got about 20% at very high confidence now.
Nice, nice,
This was a really just an excellent presentation.
nice. Well, thank you. Thank you.
I know I learned some tips for sharing stories within our organization too.
Yeah, and I do think, honestly, and I'm going to say it again, I probably said it before, but that we are, for our client base right now, storytelling is really, it is becoming a piece to, we use storytelling a little bit initially to get people to re-engage in their health, because we went from one situation of like stay away and then inviting them back. So storytelling helped with that. But now it's helping again, as I said, on that tail end when I showed you the hope piece and those types of stories, to say, we want you to feel confident. You can trust to still come here for care. We've got this thing figured out that, that we're separating things. We understand that. But the personal stories that we're delivering babies, we're doing things like this day to day still. So, and, we're here for you. So,
Yeah. And also our upcoming toolkit that Legato is helping to create for us are really going to include some templates for some of those examples that Brian shared today.
Yeah. Yep. So as part of this post-webinar survey, I believe Kim is going to be sending this link to you also, but it will be available obviously here in the presentation that you can access it this way. It is going to offer us the opportunity, as mentioned, that we want to hear what you thought about what we had, what we covered. This, a lot of the subjects that we touched on, we did obviously survey for earlier, and these 8 were the ones that were ranked the highest. Obviously, there were other things on the list that we did not cover, so maybe those are future opportunities. But we are, obviously getting your feedback of what you thought of this. And then we're also including an open-end question about what you're looking for. That if we do future ones, what would you like to hear about?
Yeah, and this is a really short assessment. And even if you didn't attend all 8 of the webinars, or if you just listened to a webinar playback, you can still complete the short assessment, and any feedback from you is greatly appreciated. We'll definitely use that as we continue to develop other offerings from the Delta program.
Hi, everyone.
Hi, Mike.
Hey. I just wanted to pop in real quick too, and Brian, you did a great job as usual, so thank you. And
thank you.
Just wanted to, thank everyone for allowing us to share our thoughts with you, and I just want to share a personal, heartfelt message to you that I wish you and your families blessed Christmas and happy holidays and a happy New Year.
Thanks, Mike. You too. It's been wonderful working with you all, and I'm so happy that many of you on this webinar today have been with us throughout this whole series. So we're really excited about this next piece here, the toolkit.
Yes, yeah. So we're just kind of teasing you with the toolkit here today. With that, when we go back to the summit that occurred is September, I believe it was. Within that, it was introduced that there was going to be a communication toolkit developed, and we again, seeked out a little bit of what people were looking for. But with that, what we're in the process of finalizing at Legato is if you want to say, a turnkey program for you for customizable templates that you can access. Within that, we have a series of campaigns that are within there. There's a confidence campaign. Health screenings, so 3 different types of health screenings, being colonoscopy, mammography, and Medicare wellness. Swing bed. There's also telehealth, like we talked about in the last webinar. And with each of these, there's a different mix of items that are there that, as I said, are customizable. You'll be able to go in and download, say, for instance, a print ad, be able to download that and be able to customize it with your organization's logo and URL and things like that. But radio scripts and digital pieces too of this and other things, brochures, collateral, and we'll get into that obviously. But go ahead, Mike, what were you going to say?
Yeah, and just to add to that, I mean, as you mentioned, we'll share this when we roll this out, but part of this package also allows a number of hours for each of you to be able to work with us to help you to coordinate this. That's part of the package. That isn't an additional fee for you. So we know that many of you have, you know, one-person departments, or if you even have a one-person department or whatever, but just how to get all of this going in your organization, that's part of what's offered to you as well.
And when we say how to get going, that can include that we assist with the customization. So, because we are here to help you out do this. I mean, good example, and I'm teasing you with this, but if you were on the last webinar on telehealth, there was some samplings of telehealth pieces that you could see the physician on the screen. That's the type of thing that we can help, that you send us a picture and we can actually place that into an image to make it real. That the photograph that's in the print ad features one of your providers. So that's a type of customization we can do besides adding your logo. We're going to talk through this on February 4th. That's going to be, you thought we were done with webinars. Nope, we got one more after the first of the year. So it's going to be the how to use, and maybe it might be a different title, but right now we're going with how to use the Delta Communications Toolkit. And Mike and I will be a part of that. And we'll take you through each of these, and we'll talk about you know, the basics of where it's located and how you can update that. And then if you do need assistance, how we can help you with things. So plan on that, plan on attending that. And we'll share all the pieces at that point of the different campaigns.
Yes, this is very exciting, and we can't wait to work with you even more on this. And
Yeah.
thank you so much again to Legato. Thanks for everyone for joining us today, and any other day you were able to join us. The recordings, like I said, will be available shortly, and I will be sending that out to everyone on our list of Delta, or everyone. We will send that out to you shortly. And thank you so much for taking a little bit of time to just give your feedback on that short assessment. Thanks, everyone. Oh, you know what? I'm going to ask if anyone has questions. Tina, do you have a question for us?
No, I don't have a question at this time. I think the seminars have been great. I've enjoyed them a lot. And not only has it introduced some new thoughts, it has also given me some good reminders. So I really appreciate it. It was awesome.
Thank you.
That's great.
Thanks, Tina. Any other questions, anyone?
Well, I want to thank you too. And I did find the Zoom on my laptop, so I'm getting better. Yes, this was really good because you know, he talked about the beginning, the middle, and the end. So then I rethought what I'm getting ready to write, and I thought, well, it really began with our virtual town hall meeting, and then we did the survey. And so what I'm doing now is giving them the results. So if I recap, you know, the town hall meeting and some points from that, and then where we're going to go is our results from the survey. So I have my beginning, middle, and end.
There you go.
So thank you.
You're welcome. And by the way, Geneva, I lost my Zoom this morning too. It was really weird. It was like, this is not the day to lose Zoom.
I know. I've had two Zoom, and I had to do the first one on my iPad. That's why I carried my iPad and laptop. But,
there you go. Yeah. All right. Well, thank you.
Thank you.